Good afternoon and a very warm welcome. It's a great pleasure to be part of this conference. Thank you all for being here. After hearing a great session from Dr. Radha, how patients are being handled, how the nutrition care is being given, and what exactly is being done, my next job is to work on what are the nutrition solution options which you could incorporate in the practice, which the patient can benefit from. So quickly to set the context, chronic liver diseases and the nutrition support. We are very well aware nutrition is very important, not only therapeutic point of view, but also the prognostic point of view. The right nutrition is very important. That you also have progressive deterioration happening in the liver disease. With this, there may be different requirement of different stages of the disease which need to be taken care. There is high prevalence of malnutrition, as Dr. Radha has already discussed, but then this leads to poor prognosis, which really need to be dealt with strong hands, because a lot of intervention is required over there. Then you have altered nutrient metabolism. There are a lot of things happening around here in terms of nutrient absorption, nutrient metabolism. Then the symptoms which give a lot of challenges. So feeding the required quantity of nutrients become a big challenge. And right nutrition support therefore is needed for the patients with chronic liver diseases. So in terms of supplementation, if the diet is not enough for, say, OPD patients, then the supplementation could be really looked into, because the aim is to meet the nutrition target for the patient has become very important. So you have scientifically designed formulas which, are the feeds which can help them meet nutrition requirements and also support better clinical outcomes. So what type of formulas are available, what type of formulas could be used in your practice depending on the need of the patient. There are standard polymeric formulas, which are complete nutrition formula, which could be used for enteral feeds. There could be oligomeric formulas or semi-elemental formula, which are mainly peptide-based formula, which may be needed if the digestion and absorption is compromised. Then you also have monomeric formula, elemental formula. Even further, if the digestion is compromised, absorption is compromised, this something really suits the patients. Then we also have hepatic formula, which could be balanced nutrition, where protein could be somewhere 10 to 20%, or you may have high protein formulas ranging from 45% to 60% protein, which would help to meet the protein need and other nutrition requirements. So the route could be oral or route could be enteral feeds, looking at the formulations. So when it comes to the nutritional needs, Dr. Radha highlighted the key insights here. In terms of the key challenges, what we face handling the patients is impaired, of course, the macronutrient metabolism. Then you have also glucogen store is affected. There is increase in resting metabolic rate, which increases the energy need. And of course, loss of muscle strength is very typically seen in the later stage of liver diseases, which leads to protein calorie malnutrition and sarcopenia. So in terms of management, Dr. Radha has already presented, but overall, meeting the high protein and energy need becomes a big challenge, where commercial feed could probably be used. So increased protein and energy intake, I'm going to cite and quote one wonderful study, which was focusing on ambulatory cirrhotic patients. They were followed for 48 months, and what they looked at the dietary protein intake, how much was the intake and what was the consequence in that. So it clearly showed, the study clearly showed there is a reverse association between total dietary protein intake. It also showed higher protein intakes, especially of dairy origin, have reduced the risk of cirrhotic-related mortality, as well as, that was beneficial in terms of reducing the risk ratio. So these are the studies which we picked up. There are many studies which have kind of highlighted the role of increasing protein in the diet, supplementing protein in the diet. So when it comes to practical management, requirement when it is increased, if you take an average weight of a patient ranging from, say, 50 to 60 kg, you have to meet somewhere 60 to 90 gram protein per day. How will you build it up in the normal diet? That becomes a big challenge, where commercial feeds can come to your rescue. It can really help to support the protein requirement. A formula containing 45 to 60% protein could help improve protein requirement. when we know that, the breakfast rich in protein, when we look at typical Indian breakfast, it's quite high in carbs, and the patient already has anorexia. So a small quantity of concentrated protein feed along with breakfast would also help. A formula could be used for such patients to improve the protein in the breakfast. BCA, yes, all of us have a very big, good understanding about the Fisher ratio, which is disturbed here, which is again leading to sarcopenia and less muscle synthesis and more breakdown. Turnover is much higher, which is again leading to more complications. So BCA has supplementation, definitely has role. The guidelines also have highlighted this to a great extent. Long-term supplementation of BCA should be prescribed for the patients who have advanced cirrhosis. It improves the survival of these patients. There are systematic review and meta-analysis available, which have kind of shown it to the great extent that significant improvement in skeletal muscle index as well as MUIC has been seen. Besides that, reduced rate of complications in liver cirrhosis is also been observed with BCA supplementation. So again, it comes to the calculation the patient needs. When we talk about, if we consider the average weight, 50 to 60 kg of body weight, if you need BCA of 12.5 grams to 15 grams, how will you support that from normal diet? A supplementation, a commercial formula can be used to provide adequate quantity of BCA in the diet. There are several benefits. I'm sure people have gone through this literature and the paper, but it's clearly showing that energy-dense, high-protein BCA supplementation, it's not only giving BCA, but ensuring the right energy as well as protein would help in better outcomes. It would help in preventing muscle loss as well as sarcopenia. Then improve serum albumin concentration, reduce CLD complication, detoxification of ammonia in muscles, improving quality of life as well as improving glucose uptake by skeletal muscle. These are the key benefits which have been seen in the literature, and I'm sure in practice also you would be noticing this. When we talk about malabsorption and depletion of nutrients, it to do with fat, they could be malabsorption of fat. MCT containing supplement could be beneficial for the patients. Vitamins, we do know that there is depletion of B complex vitamin, especially thiamine, vitamin D, fat-soluble vitamin, minerals, zinc, calcium, magnesium, potassium is seen that there is a depletion. Antioxidants would probably also have a good role. There are a couple of papers available on this as well, which stating that inflammation, with increase in inflammation in liver diseases, kind of is associated with progression of CLD. So kind of preventing oxidative stress is something which is required. Immunonutrients formula could contain these. So a fortified formula with micronutrients supplement would be able to meet the dietary need. It could also support reduction in oxidative stress and improve immune function. At the same time, improve dysgeusia in certain patients, especially the zinc and vitamin A has a great role in it. So a supplement containing these nutrients would be beneficial for patients with CLD. When we talk about sodium, yes, there may be restriction of water as well as sodium as CLD progresses. So sodium restriction and fluid restriction may be advised. To these patients, we don't, as there is salt restriction happening, on top of it, if you're giving a commercial supplement, you don't want to load patients with more sodium. So a supplement with low sodium content would definitely add value. So fluid restriction and nutrient density could be another very important element. You need a formula which is concentrated, which is more energy dense, nutrient dense, and protein dense, because the volume may be a problem. There may be fluid restriction, there may be anorexia in patient, which makes it difficult to have larger volumes of food. Portion sizes cannot be managed. So concentrated small volume of feed or commercial formula can be very helpful for these patients. So in summary, medical nutrition therapy play a very important role, not only at the therapeutic, but also prognostic level. And a formula providing adequate energy, high protein, balanced micronutrients, antioxidant, having good palatability, at the same time tolerance, would really support the clinical outcomes of chronic liver disease patients. Thank you.